Hi everyone, I'm Dr. Michael Miyazaki and I'm a dentist just like you. Now, are you tired of placing your direct composite restorations and then having to grind it all down? Don't you wish you could just place your composite, take it to your final contours, cure it, and then just polish it up? Well, you should and you can. Today we're going to be talking about lessons I learned from my contractor. As many of you know, we've been working on a home remodel. And when the contractor comes in, they have to tape up the gaps, they have to cover the nail holes, they have to repair the walls. And as they fill those holes and spaces, they need to minimize the time it takes to finish everything up. Because for them, time is money. Well, for us, we have the same problem. When we place a restoration, we have to go in there and make sure it's all nice and smooth. But for us, it's not just time is money, but it could affect our neck, which means the faster we get done, the better it is for our body. Today, I want to show you two things that I've incorporated into my practice to make every day easier. And then at the end, we'll talk about a case. All right, so what we see here is you see our kitchen. And we tore all the cabinets out, we took all the flooring off, we had to redo the ceiling, and the contractor went in there, re-drywalled everything, and they taped up the seams, and now they've got to go back and make sure everything's nice and smooth. Now, this is one of the jobs that we do in our profession every day, is that we create holes and then we fill those holes up and then we have to go back and make sure everything's smooth. We even have to make sure people can floss. So today we're going to take just a typical case. This is a patient, he came in, had an old restoration on the front right central incisor, and right at the gum line there's this old class 5 that needs to be redone. It is breaking down, it is leaking. And he had recession in some other areas with some sensitivity. So we decided to take that old restoration out and to cover up some of the other exposed root areas. So I've shown you this before, but this is my restorative armamentarium that we have over here on the far right hand side. Just some of the things I use. My curing light is a PinkWave. My flowable composite liner is a Regen bioactive materials. Then we have the Desensamax. We have the Regen bioactive adhesive. We have Clean and Boost, which we've talked about before, that we can gently etch the tooth surface. Bottom we have Quick Step Free, which is my favorite clear hemostatic agent if I have to worry about any tissue fluids around the area that I'm going to place my restoration. But what we're going to talk about today are two of these items, and that's our Phaser composite warmer and Seam Free, which is my composite wetting resin. And these are the two things that, since I've incorporated in my practice, have made my life much easier and has really helped my neck pain go away. So what is Seam Free? Seam Free is a composite wetting resin and lubricant. When we take composite, oftentimes it's stiff and it sticks to our instruments, and that's what makes it very hard to sculpt when we place our composite, whether it be a class 4, a class 5, even a class 1 on the posterior. So what I use now is seam-free composite wetting resin. Put just a little bit on your instrument and you can go back to that composite and you can spread it out without your instrument sticking. Now this is a composite instrument, but nothing real special. I've used just ordinary instruments, condensers, and I put a little seam-free on there and the composite doesn't stick. What that allows me to do is it allows me to contour and blend all my composite to the tooth or to the previous layer of composite that was placed. And so we won't have any gaps in between our composite layers, and I can contour it and get everything nice and smooth. This makes my life so much easier. The seam-free composite resin is so important to me that every time I use a direct composite, my team knows I need to have just a little bit on the back of my glove. Now, the next thing that I've incorporated, because I said there was two things I incorporated, and that was thermally assisted composite polymerization, which just means we are going to polymerize our composite after it's been warmed. When I use a composite warmer, that helps us really sculpt because it takes a very stiff composite and it makes it just very pliable. So it not only improves the physical properties of composite, and that's why you see so many companies nowadays coming out with composite warmers, because it does improve the physical properties of the composite. It lowers the viscosity of our composite so we get better adaptation. If I'm placing this in a class 2 box, I can better contour my stiff composite against the walls and into the box forms that we may have placed for our composite restoration better if it's warmed. If I can adapt it better, that means there's going to be less voids in the material itself and at my tooth composite interface. It also, by warming the composite, reduces our polymerization shrinkage. So all these good things mean less microleakage. If we have less microleakage, there's less chance of sensitivity, a longer lasting restoration, and less chance for stain along our margins because we have no gap at all. Now there's two ways that I warm my composite. On the left-hand side, you see the phaser composite warming system. That's basically a composite delivery gun that not only can help you deliver the composite, but it warms the composite. So that one is very easy to use and very quick. Within about 45 seconds, I can warm a composite up to around 150 degrees. On the right-hand side, we have a benchtop thermoflow composite warmer. You can put your syringes of composite in there. You can put your little compules of composite in there. And one thing I wanted to mention is once you take that thick composite and you thin it out, over here where I'm highlighting, these little tips, those are step-down tips. I know some of our doctors do very conservative restorations, and what these tips allow you to do is take your compules of composite, you screw that onto the tip of your compule, and once that very viscous composite has been softened because it's been warmed, you can express it out of these little step-down tips. And if you have a really conservative little box form, you can put that tip in the bottom of that box and fill it up, almost like your flowable composite with the little needle tip that you put down into the box form. So this gives you the ability to take your sculptable composite with all its great physical properties and place it in a very conservative box form and then cure that. So this really makes dentistry a lot easier. But let's go back to your composite wetting resins and what some of the alternatives are. I know in the past I've used a little alcohol in the 2x2, or I've used a little bit of the adhesive that I have had left over from applying onto my preparation, and that's what I'd use as my composite wetting resin. Problem with those is if you're using alcohol, it is a solvent. So one of the things that we do is when we place our adhesive, we mentioned before, is I try to evaporate all the solvent away because I don't want that to affect the physical properties of either my adhesive or my composite. If I'm using my adhesive, many of the adhesives have a photoinitiator in it, and then they could have fillers in it. So if I'm using my adhesive and I'm putting photoinitiators into my composite that I'm trying to sculpt, my composite can then begin to cure because it's a light cured photoinitiator. And then with the fillers can add another layer in between my layers of composite. So if you've ever used your adhesive to help you sculpt your composite, let's say you put one layer of adhesive, let's say you put one layer of composite down and then you put another layer and you're using your adhesive that is highly filled, then when you polish those composite layers down, sometimes you'll see that little white line. Well, that could be because of the filler layer in between those composite layers. So with seam-free composite wetting resin, it does not have any photoinitiators in it, so it's not going to affect your setting time. It's not going to hinder your polymerization either. Has no solvent, so it's not going to affect the physical properties. All it's going to do is it's going to facilitate the adaptation of your composite to your preparation. And if you, sometimes I've had really hard, almost dry composite, and I'll use the seam-free and I'll put that on that composite, and it'll moisturize it and help me use that composite and spread it out very nicely. The seam-free composite resin saves me a lot of time. Every time I place a direct composite restoration, my team is sure to have some of the seam-free on my glove. And it doesn't even take a full drop. What we do is we put maybe a half a drop on the back of my glove, and I just place my instrument into the seam-free. A very thin layer of seam-free goes on the instrument, and then I go back into the mouth and I can spread that composite so much easier. Once I've done that, I can take that composite to a final contour, cure it, and have very little adjustments to make in the shape. I just go back in there and basically polish it all up, and it saves me a ton of time. Going back to that central incisor we have on the patient's front right, you can see I removed the old failing composite restoration. In this case, I didn't use a drill. We have not numbed the patient up. I just used air abrasion. Air abrasion removed that old composite restoration, and now we're ready to go. The air abrasion also was used to prep the other class 5 areas that you see at the cervical area, just to clean off the plaque and to gently make a little bit of mechanical retention up there with a very fine abrasive. So now the technique overview is, again, I mentioned it before, no anesthetic was used. We just used abrasion to remove that old class 5 on that right central incisor and to clean the other cervical areas on all these other incisors. We actually went, I believe it was from cuspid to cuspid. At this point, the patient wasn't having sensitivity, so we used phosphoric acid etch, our velvet etch. We place that in the areas where we're going to place our composite. Let it sit there for 15-20 seconds, and then we rinse that off. When I rinse it off, make sure we get rid of all the pulled areas of water and just leave the dentin slightly moist. I then use my Regen Universal Adhesive, place that across all the teeth that we're going to restore, let it soak in for about 15 seconds with just gentle agitation, and then came over with a gentle stream of air just to evaporate off the solvent, and then a little bit more vigorous air to really thin it out so we don't have a layer of adhesive that's visible once we place our final restoration. At this point, I go back and I cure the adhesive for about 3 to 5 seconds just so it's set, using our PinkWave curing light. Then I use my warm composite and I place it in that cervical area, take my instrument and put a little bit of seam-free composite wetting resin, and I just create the contours at the necks of all these teeth, and I just flatten it out, wipe off the excess, and I flatten out and shape it, wipe off any excess until I have it basically to its final form. Then I use the PinkWave curing light and I cure that composite in those cervical areas. Now I'm ready just to polish it up and then to check the occlusion, because is the occlusion the reason why we have these abfraction lesions in here? If it is, then we need to adjust the bite a little bit. So here is the composite, the sculptable composite coming out of the phaser. So the phaser has warmed my composite, making it very easy to place in these class 5 areas, and we get great adaptation. Here I'm taking my little composite instrument that has a little bit of seam free, and I'm just slipping it underneath the gingiva to make sure I have a sealed up gingival margin. And I'm coming across the facial to make sure we adapt that composite to that tooth surface. And I'm developing the cervical contours of that composite. And then we'll come back in here and cure that with our PinkWave curing light, which again has that 12.1 millimeter diameter head. So I can cover really almost 2 teeth at a time. I'm just using standard mode, so we have a little bit over 1500 milliwatts per centimeter squared of energy going out, and I can cover basically 2 teeth because this head is so large. So it's going to help me get a better cure, better depth of cure, and it's going to go much faster because we have a large curing head. So on the left-hand side, you can see where we started, and on the right-hand side, this is the restoration. It's just shaped. We haven't done any polishing or anything like that yet, but you can see I'm going to have very little time needed to finish these up. So if you do direct composite restorations, I recommend 2 things. Warm your composite with either the phaser or a benchtop thermoflow composite warmer, or use the seam-free composite wetting resin. Incorporating these 2 items into your workflow, I guarantee you, will make your direct restorations much easier to place and contour and polish. These are some of the lessons I learned from watching my contractor work, and I hope you can take these lessons and incorporate in your practice to make your job easier. If you like this information, hit the like button. If you want to hear more and make sure you don't miss anything, hit subscribe. We're trying to build a community of clinicians that are concerned about their patients and want to do the best work they can for their patients. But let's face it, let's try to make it as easy as we can for us to do. Anyway, I look forward to seeing you during our next video. Take care.